Welcome to my podcast. I'm Dr. Susan Protasio, your host, and today we're gonna discuss why exercise matters. Have you thought why it matters? My guest today is a doctor of physical therapy. She graduated from Loma Linda University, and she has been a physical therapist for 4 years at Marketplace Physical Therapy in Redlands, California. So let's welcome my guest, Dr. Rachel Kiss. Welcome, Dr. Kiss.
Thank you, Dr. Susan. I appreciate you having me on your podcast.
Yes, thank you so also for your presence. So can you please introduce yourself to our audience?
Yes, I would love to do that. Like you said, I've been a
Yeah.
physical therapist for 4 years. I specialize in orthopedic conditions, vestibular rehabilitation, and balance rehabilitation. And the kind of conditions that I treat orthopedically are total knees, total hips, and rotator cuff repairs.
Oh, that's nice. Thank you. So is there a particular age where a person can incorporate exercise in their daily routine?
Absolutely. So it's very important to start exercising as soon as possible. But after the age of 30, we suffer from a condition called sarcopenia, which is the loss of muscle mass, which happens at a rate of 3 to 5% every 10 years. And after the
Wow.
age of 65, that value significantly goes up.
Okay. Well, thank you for that information. That is very important, that kind of like muscle loss. So is there a specific exercise program that people can, incorporate or use to promote muscle building as they get older?
Yes. So when I take a history from a patient, I like to take into account their age, their medical history, and
Okay.
their prior activity level. And based on that information that I gather, I develop a specific tailored plan for that patient. So someone in their 30s, they can do much heavier weight
Yes.
for loading of the
Yeah.
muscles. But as we get older, we need to be more conscious of how much weight we are
Right,
lifting
right.
in order to prevent injury from happening.
Okay. Then how about for people in their 40s? What particular exercise program they should do?
So I want people in their 40s, I'd like them to target their upper body and lower body. So for upper body, we like to work on functional movements because we all perform sit to stands
Yeah.
daily. So performing a sit to stand with some weight for multiple repetitions in a day, along with performing upper body workouts, which is a press above your head.
Okay. Then how about those people like in their 50s or 60s? What exercise program then is good for them?
For people in their 50s and 60s,
Yeah.
they definitely need to focus more on cardiovascular endurance. So having a walk every day for at least 30 minutes is crucial for their heart health, along with incorporating functional movements such as sit to stands
Okay.
and loaded squats. But their weight would be tailored based on their
Yeah.
age and their functional ability to do those activities.
Okay. So the focus now is more on the cardiovascular health, and then you maintain the balance, and then also the muscle building or to prevent loss as they get older.
Correct.
So,
Yeah.
okay, so that's good. Because one of my viewers has asked me if I could discuss in my podcast, like, the common incidents in older population, like probably like fall. So can you share your insights about fall in older population?
Yeah, I would love to.
Yeah.
Falls are very common in the older
Yeah.
population, especially at night. So anytime someone gets up from their bed in the middle of the night, their visual system is not as strong because they're in a dark room
Yeah,
and they're at a
right.
higher risk for
For
falls.
fall.
Yeah, so it's very important that we
Yeah.
incorporate balance activities that kind of enhance our other systems that help us maintain balance in order to reduce our risk for falls.
Yeah, and then also probably even if during the day, sometimes there's so many clutters at home that if there's like elderly at home, kind of, make it organized and less risk for them like falling when they walk. So is there any recommendation that you could have to prevent falls in elderly?
Yeah, so one of my favorite exercises to give the elderly patient population, as long as they only have mild balance deficits, is them finding a corner in their home, standing in that corner with their feet together, and then they cross their arms across their chest, and they try and maintain balance for 1 minute, at least
Okay.
twice a day.
Twice a day.
Yes.
Yeah, and then if they try it, be sure that it is safe for you, or you might need someone to be with you and just to see how you are, adapting to that exercise. So you have mentioned about sarcopenia. So which is the decline in muscle mass, right? And then it's related or linked to, like, I think, low energy, weakness, and like muscle weakness. So is there a recommended exercise program to combat sarcopenia?
Yeah, so sarcopenia definitely
Yeah.
leads to decrease in muscle
Yeah.
mass and fatigue. The main energy source for our muscles is called ATP, and in order to enhance the production of ATP, we have to build muscle.
Yes.
So anything that we can load our lower extremities, because these are our larger muscle groups, that would be more beneficial at restoring all of that energy level in order to reduce our fatigue level in combating the loss of muscle mass as well.
So when now it came to my mind, when they do the exercise, how often do they need to do it, like in a particular day?
Yeah, so to gain muscle mass, you need to exercise at least 4 to 5 times in a week. Sorry.
4 to 5 times in a week. So what would be the duration then? Like 10 minutes, 50?
30 to 45 minutes would be an appropriate duration. If you did a little bit of cardiovascular work before you did your exercise routine, that would be anywhere from 10 to 15 minutes. And then the last half of your exercise workout would be more tailored just to
Yeah.
the strength training.
Yeah. Oh, so that's nice. That's doable if it is 4 to 5 times in a week. So what do you think are the challenges that people encounter when they try to get fit, you know?
I think the main challenge
Yeah.
is, and what people misunderstand, is muscle soreness.
Okay.
A lot of people mistake muscle soreness for pain, but day after muscle soreness, or also known as DOMS, is very common and does happen while we are gaining muscle mass. So that is a normal occurrence.
Okay, so
yeah.
that's good.
The other common thing that I find people is consistency. You know, people need to remain constantly working out. So they have to hit that minimum of 3 to 5 days a week working out in order to build muscle.
Muscles.
Yeah.
So if I'm exercising and I felt the muscle soreness, then probably I could just apply a warm or cold compress to kind of soothe the ache.
Warm is actually better than cold.
Okay.
We use ice for more of an acute injury. So if you were to have injured yourself, such as twisting your ankle, that's when you would apply ice. But more often we use heat to combat muscle soreness.
Combat.
Yeah.
And then just apply it and let the muscle relax so the soreness would go away.
Correct, for about 10 minutes.
10 minutes.
Yeah.
And then I could keep doing it as I progress. And then as I progress with my routine exercise, the muscle soreness goes away, right?
Eventually, it does
Eventually,
go away.
muscle,
Yeah, you develop a baseline.
A baseline.
yeah.
And then that's the time that the muscle starts building.
Correct.
Oh, that's awesome. So can you share with us or with our audience your to-go-to routine exercise?
I would love to show you my go-to exercise routine. All right, this is my go-to exercise routine. Number 1 for upper body, you'll need a band. You will put that band around your wrists. Your elbows will be tucked into your rib cage, and you will be pushing out against that band while squeezing your shoulder blades. You're gonna hold that for 5 seconds, and you will do 3 sets of 10. Number 2, you will need some small dumbbells. These are 3 pounds, but if you're first starting off, I recommend about 2 pounds. You will take the dumbbells and we will do a press. Once again, you want to think about holding your shoulder blades together as you press up. And you will do 3 sets of 10. The next one is for core, and so you will stand up. It's also for balance. Your feet will be together. Your arms will be across your chest. You'll be in a safe environment for this exercise. I prefer it to be in the corner of your house, close to a wall. And you will close your eyes. And you will hold this 2 sets for 30 seconds. The next 3 exercises are for lower body. You'll use that same band. You will put it above your knees. You will sit at the edge of a seat, upright posture, and you will move your legs in and out for 3 sets of 10. After you complete that exercise, we're going to be working on that functional movement that we talked about with the sit to stands. The band will stay above your knees, arms across your chest, and you will stand up and sit down while maintaining pressure on that band. Once again, 3 sets of 10. Last exercise, you will stand up, You'll find a place in your home where you can walk sideways. You'll do a mini squat, making sure that your knees stay behind your toes, and you will walk to the side. This exercise we do for amount of feet. The goal is to do 10 feet for 4 sets. And that is my go-to exercise routine.
So, if there is one thing you want to say to our audience, what would that be?
I would say it is never too late to start exercising. I do think that having a professional opinion and guidance is crucial, but it's never too start to stop, or it's never too late to start.
Yeah, I think, yeah. Thank you. That's so awesome, you know. So, thank you so much for this engaging conversation and for sharing your knowledge with us. And I would like to tell the viewers that exercise matters. And then when you do regular activity, it increases your life expectancy, it reduces your chronic disease, and it can elevate your mood. And I would like to share, before we end, I would like to share this exercise motivational quote by Jeffrey Geithomer. And it says, "Obstacles cannot stop you. Problems cannot stop you. People cannot stop you. Only you can stop you." So thank you so much for watching. Be sure you click the subscribe button, and I'll see you in the next episode. Take care of yourselves, and blessings.